From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is National Nurses Week celebrates nurses advocating, leading, and caring May 6th through May 12th, 2012. Every year, the American Nurses Association, the ANA, celebrates National Nurses Week, starting with National Nurses Day on May 6th and culminating on May 12th, Florence Nightingale's birthday. This year, as in the past, Bon Secours is celebrating across the system with a variety of activities sponsored by BSN and organized locally. Here at BSN Headline News, we are celebrating all month long with stories on what it means to advocate, lead, and care from the nurse's perspective across the system. Often described as an art and science, nursing is a profession that embraces dedicated people with varied interests, strengths, and passions because of the many opportunities the profession offers. Nurses at Bon Secours work in emergency rooms, operating rooms, and in the classroom, just to name a few. They are staff nurses, educators, researchers, practitioners, and a myriad of other roles too numerous to mention here. But regardless of the role they play or where they work, they all serve with a passion for the profession and a strong commitment to patient safety. In celebrating National Nurses Week, Bon Secours recognizes the many contributions nurses have to the ministry and hold them up as daily examples of being good help to those in need. In this first story in our series of nursing and nurses, we had a chance to talk with one of our favorite nurses at BSN, Pam Hash. Here, we talk a little bit about the many roles nurses play at Bon Secours. Let's listen in.
I'm Pam Hash, and I'm the director for the Institute for Nursing Practice for our health system. I have been a nurse for around 27 years. I started as a staff nurse in the intensive care unit, and I've worked in emergency department. I've been a house nursing supervisor. I've been a director. I've served in a variety of roles.
You know, when most people think of hospitals and they think about employees at a hospital, they think about nurses. But nurses actually have a lot more roles than just as a care provider in a hospital setting.
Yes.
Or is that true?
That is true.
Okay,
and
tell me a little bit about that.
Well, and especially in our health system, there are numerous opportunities for nurses to serve outside of hospitals.
What are some of those opportunities?
For example, we have nurses that serve in our long-term care facilities. They are directors of nursing, nurse managers. We have LPNs that serve as direct care providers. We also have support staff that support our nurses in those long-term care facilities. They work in home care, our ambulatory settings, including our physician practices. And then we have nurses that serve in non-traditional settings such as outcomes management, quality, risk. It's just unbelievable. And we do have a nurse that serves as a chief executive officer in one of our hospitals. And education is a huge component of nursing practice. We have nursing educators that serve the nursing staff and help to build competency and make sure that we stay up to date on all the evidence. But we also serve as patient educators. And nurses teach classes such as our childbirth classes, CPR, all kinds of things for our different populations, orthopedic classes to prepare patients for hip replacement. So education is a huge part of nursing practice.
You know, there's one other one I didn't hear, and many of the sisters are nurses.
Yes, they are. Yes, they are. Most of them did start as nurses. You see a lot of our sisters either being educators or nurses, and we do have quite a few. So it's really wonderful to have advocacy for nursing at that level.
Be sure to watch BSN Headline News next week when we talk to Bon Secours nurses about what it means to advocate as a nurse. Please join us in celebration of Bon Secours nurses everywhere who provide good help to those in need through advocating, leading, and caring. In other news, Bon Secours Mary Immaculate Hospital goes live with Connect Care on Sunday, April 29th, 2012. By now, most of you are familiar with Connect Care and what it means for the future of Bon Secours. And now, Mary Immaculate Hospital is part of that growing group of facilities with one of the most advanced and innovative electronic health record systems in the United States. According to Bon Secours Hampton Roads CEO Michael Kerner, advancing clinical innovation and providing an extraordinary experience of care are directly linked. The Connect Care electronic health record supports our mission to bring good health through innovation to the communities that we serve. Bon Secours Connect Care links all patient medical information, including medical history, allergies, test results, and medications, in one secure and confidential electronic record. According to Patricia Robertson, CEO of Bon Secours Mary Immaculate Hospital, we are very excited to implement Connect Care at Mary Immaculate. We have made a big investment in technology and training and look forward to positive patient experiences. Indeed, according to James Sammons, MD, Vice President for Medical Affairs at Bon Secours Mary Immaculate Hospital, more than anything, patient safety. If we did nothing else with Connect Care, it would be worth every penny we are going to pay for it. I see this as a tremendous benefit for our patients, our physicians, our system. Everyone's going to benefit from this. Please join us in congratulating Bon Secours Mary Immaculate Hospital as the newest member of the Connect Care implementation family. Finally, Bon Secours Health System takes the top award from Practice Green Health. On May 3, 2012, Practice Green Health announced that Bon Secours Health System was selected as winner of their 2012 System for Change Award. This Environmental Excellence Award is given to health systems which have proven success in improving environmental performance and demonstrated dedication to a higher standard of sustainability. Practice Green Health is a non-profit membership organization founded on the principles of positive environmental stewardship and best practices by organizations in the healthcare community. Practice Green Health's mission is to collaborate and provide education, tools, and information about the best environmental practices to help healthcare organizations supercharge their operational efficiency, increase regulatory compliance, and improve the health of their communities. According to CEO Rich Statuto, Bon Secours is extremely proud of our facility's achievements in ecological sustainability. For the third year running, our efforts for environmental excellence are raising the expectations for ecological stewardship while fulfilling the health system's commitment to be proactive in healing the earth. Please join us in celebration of Bon Secours' landmark achievement of receiving Practice Green Health's 2012 System for Change Award. Well, that's it for this week. Oh, don't forget about the Employee Engagement Survey going on now through May 20th. Well, that really is it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.